Welcome to the True Health Talk Show with Dr. Brian Wickstrom. Dr. Wickstrom is a health and wellness professional whose mission is to help people understand and express the perfection that is within by sharing secrets on how to truly live a healthy, holistic lifestyle. Now here is Dr. Wickstrom.
Hello and welcome everybody. You're dialed into the True Health Talk radio show with Dr. Brian Wickstrom. I'm a chiropractor here in the Spokane Valley area. And if this is your first time listening to our show, just thanks for joining us. What our show is about and our motto here on the show is when lies are told, truths unfold. And so that's what we want to share with you guys here each and every week on the show, is really helping you dive in and sort through the myths and misinformation that's out there in the news, in the media, in on the internet when it comes to all areas of health and wellness, whether it be nutrition, toxicity. Today we got a really great show, though. This has been a hot topic, especially with the prep sports area, is concussions or traumatic brain injuries. And so this is something that many of you out there probably suffered from if you've been in any kind of like car accidents, falls, you played sports. There's a good chance that you maybe had one of these, or possibly didn't even know it. And so what is a concussion? What is a traumatic brain injury? So basically what happens with that is when some kind of trauma and the brain bounces around within the skull, and that can result in a certain extent of bruising, potentially even some bleeding. And it can also damage the nerve cells of your brain. And so this is a pretty common problem. We're starting to see a lot more and more of this as time goes on here, or at least they're recognizing it more. That's why there's a lot more promotion about it and kind of awareness about it now in kids' sports and in the NFL and NHL as well. But according to the CDC, there's about 3.8 million traumatic brain injuries every single year here in the U.S., and it's estimated about 30% of all injury deaths come from some kind of traumatic brain injury or head injury. And also about 2.8 million visits to the ER, and 50,000 people die annually from these traumatic brain injury events. So it's a pretty big problem. 50,000 people, I think that's a big number. So what are some of the main causes for these injuries? Are number one, falls. Some falls from, down the steps, from, skateboarding, things like that. So 47% of these injuries are a result of a fall, but it can also be hit from an object. So this is typically where we see, sports injuries, soccer balls, hockey pucks, things like that can all cause a traumatic brain injury. But the other thing, the number 3 cause is motor vehicle crashes. And that's about 14% of all of the concussions or traumatic brain injuries come from car accidents. So when you have these injuries and you have suffer from a crash, basically you can have different signs and symptoms. So it depends really on the person which symptoms that you're going to start to show, if any. So number one, it can be thinking, remembering. So you can have brain fog. You can have problems with concentration. Your memory goes down. I had when I was growing up, I was playing hockey back in Minnesota, and I actually I still even to this day I don't even remember what happened. But I think I ended up going into the boards wrong, or I hit my head on the net, and I was actually playing several shifts after the injury, and I was looking over to my line mate, and I was like, "Where am I?" And so I got the coach, and basically had to go off the ice and didn't play for a little while after that. But basically, like, I had no idea what happened, where I was, and that's a common sign that you had a concussion. So fortunately, they were able to catch that, and I went in and had the proper testing done, and didn't play for a little while to let my brain and my body heal. But sometimes people can have other symptoms as well. So you can have like a headache, you can feel dizzy, tired, have problems with your balance or coordination are also common signs and symptoms. Sometimes it can affect people emotionally. So you might feel sad, you might be more irritable, you can be nervous, anxious. And so if it's out of your normal, like following some kind of injury or event, then there's a good chance that you probably do have some kind of concussion or injury there. But also any kind of irregularities in your sleep patterns or cycles. So if you're sleeping more, maybe you're not sleeping as well, sleeping less. So those can all be signs that you have something going on. And you especially want to seek out some immediate medical attention if you've had like a headache that's persisted for a while, it's not going away, any kind of weakness, numbness, balance or coordination issues. If you find that you're starting to slur your speech, your pupils and your eyes are irregular in size or imbalanced, and any kind of like vomiting, if you're nauseous, or just any kind of unusual behavior. So those are all signs that you really need to be going in and getting checked out immediately to find out what's going on, making sure that you don't have any extra brain swelling or maybe even bleeding going on in your brain, and find out exactly what's happening there. So, but one of the things that we see, a lot on our end in our office that results from these injuries is, sometimes the signs and symptoms that I just went over with a concussion can actually overlap with a problem or a misalignment in your spine, which is what we call subluxation. So chances are, if you hit your head hard enough in a fall, or you're in a car crash to cause a concussion, then chances are it's probably caused some damage to your spine as well. And so your brain and your nervous system controls and coordinates everything that's going on in your body every second of the day. And the way that it does it is it sends messages up and down your spinal cord, out the nerves, out to the body, tell things what to do, when to do that. And your nervous system is surrounded and protected by the spine. And the spine needs to be in proper position and alignment for the brain to get the messages out to the body like it should. So from the front, the spine should be straight. From the side, you want to have 3 curves in the spine when you look at it, and that enables the spine to bend, move, and twist, keeps the disc spaces nice and open. And so if things are in good alignment, there's no interruption or disruption with those messages getting out to the body. If it doesn't look like that, so say from your car accident you got whiplash, or you had the fall and one of those bones just kind of shifted slightly out of alignment, then that can disrupt or distort that signal getting out to the body along that nerve, and that can cause pain, headaches, dizziness, fatigue. A lot of those issues affect your sleep. A lot of those issues that I mentioned earlier can all come from those misalignments in your spine. So it's kind of similar to getting bad cell phone service. Okay, so if you're trying to talk to somebody on the other end of the line, but you're only getting one bar, then you might know exactly what you're trying to say, but the message isn't getting through. It's getting distorted. They might only catch bits and pieces of it. So that's basically the same thing. The brain is trying to send messages out to the body to tell it how to respond, what's going on, and regulate your physiology and your bodily functions. But if there's a disconnect there somewhere in between, then those organs aren't going to work well, and over time, it's going to start to shut down and will lead to disease. It's just a matter of time. So one of the interesting things that I learned here recently as I was doing some continuing education for my chiropractic license is that even just about an 8-mile-an-hour impact. So if you've been in a car accident where you're going 8 miles an hour or more, that's enough to cause the head in the car to move up to 18 inches and puts upwards of 7 G's of force on your spine in less than a second. So to put that into perspective, the Discovery Space Shuttle was only built to withstand a max of 3 G's of force. So just the 8-mile-an-hour car accident can put upwards of 7 G's of force on your spine. And so it's no wonder why you can have some problems or misalignments there. That's a lot of damage and force in a short period of time. And the thing is that oftentimes people don't get their spine checked out, or maybe they go into the urgent care or the hospital or something. They do an X-ray. They tell you that your spine is fine. There's no breaks or fractures there, but they're not looking at the alignment of the spine and the effect that has on your nervous system, because that is not something that they do. Okay, if it's not a immediate risk to your life, and you're bleeding or have a broken bone that they can put a cast on, they don't address that. Okay, and so the thing is that 90% of the stimulation and nutrition to the brain comes through movement of the spine. So if you have a misalignment there, then that can not only affect you, if you did have a concussion too, it can affect the ability of the brain to heal and to function normally, because it's beginning abnormal signals from the body if there's a subluxation. And so you got to find out if you have those going on. So that's why it's really important if you've had any kind of head trauma, car accident, fall, to make sure that you get your spine and nerve system evaluated. So one of the unique things that we do in our office is called a motion study x-ray. And so that's where we have people, look down and look up or bend from side to side, depending on what's going on and where we're doing the study. And that tells me if you've had any ligament damage. I can see which areas of the spine are actually moving and functioning normally, where you have the problems, and what exactly is causing a lot of these pain and symptoms and problems that you're actually dealing with. And so that's one of the cool things that we do in our office to find out what's happening with people and help them actually get well and heal their spine and heal their brain. And so if you're out there right now and you're suffering from back pain, headaches, menstrual problems, sciatica, maybe you're having anxiety issues, dizziness problems, and you've never had your spine nerve system checked, or maybe you've had a recent fall or car accident, then you need to do that. And so we've opened up 3 spots. So one of the things that we do in our office to evaluate your spine nerve system is we do a history, we do an exam, we do a thermography scan along your spine to find out if there's any nerve inflammation there, and then we also do digital x-rays and to see what's going on, what we can do to help you out. And so normally that's over $200 to come into our office and have all that testing done. If you're one of the top 3 callers today on the show, we're going to give you a chance to do that just for $50. So what you need to do is just pick up the phone, give us a call at 509-241-3088. Again, it's 509-241-3088. Go ahead and just pick up the phone, give us a call. If you're ready to make a change to the health, if you're suffering with some kind of ache or pain or problem, had a recent trauma, then you need to have your spine checked. And we've opened up those 3 spots to do that. So 509-241-3088 is the number to pick up and call. So I had a patient she's been coming in actually for quite a while, I think since 2012. But anyway, so when she started, she was a mess. She was, dealing with depression issues, anxiety issues. She was on 6 medications, chronic pain basically from her head, down all the way down her spine, just miserable. And, she's taking those medications just to make it through the day. But she never had her spine checked. And we went in and did that evaluation on her, find out that she had subluxation, started adjusting her. And, in just a short period of time, she started feeling better. Her headaches were starting to go away. We got her actually off all the medications that she was taking. But then, a couple of years ago, she was in a fall, and she fell down, hit her head, and suffered a pretty bad concussion. Like, couldn't remember anything. She was having balance problems. And so she came in. We had to do another analysis on her spine, see what's going on, and started adjusting her. And it really helped her get through that concussion much faster. She's back to normal again now, and just kind of coming back in on a maintenance program to keep her spine there, keep healthy, keep feeling good, and that's really what it's all about. So if you're out there right now, knowing that you're not where you want to be with your health, you want to make a change, you're sick and tired of being sick and tired, and want to get some answers, we've opened up 3 spots for the top 3 callers to come in and have a full spine and nerve system assessment done just for $50. Usually it's over $200 to do that, depending on how many x-rays we have to do. But that's a great opportunity for you to find out what's going on and see how we can help you here in our office, okay? So if you're listening to the show a little bit late here, this is the True Health Talk radio show with Dr. Brian Wickstrom. I'm a chiropractor here in the Spokane Valley area. And so today we're talking a little bit about a hot topic right now. It's football season, also coming up in hockey season, prep sports are all starting back up here. And so we're talking about concussions. And so we see a lot of these concussions happening in these prep or youth sports, also in, the professional leagues as well. But, more often than not, we see them happening from car accidents, from falls, from, being hit by some kind of object. And that can cause the brain to basically shift around in the skull and bruises the brain and could even lead to bleeding, and resulting in those symptoms that we went over that can be associated with a concussion. So what I want to talk about here in the second half of the show is to spend a few minutes going through some things that you can do to assist in the recovery of a concussion. So maybe you've recently had one, maybe you've had one in the past and still having some issues with it. So number one, you want to be avoiding those activities that you may have another concussion result from. So If you're playing sports and that's what caused a concussion in the first place, obviously you don't want to play sports again. So driving, working, things like that can put you at risk for having another concussion. You definitely want to be avoiding those, because you do not want to get hit in the head again before your brain is fully healed, because that can really cause a lot more issues for you down the road. So you want to be avoiding those until you can fully recover. The other thing here, number 2, is getting plenty of sleep and rest. So at night, when you're sleeping, that's when your body does a lot of the healing and repair from damage throughout the day, especially your brain and nerve system. And so you want to be able to give that an opportunity to heal, to not have to worry about all the other functions that it has to maintain throughout the day, and your posture and your balance and everything else. So if you're getting enough sleep, that's going to help your brain rest and recover much faster. You also want to try to avoid any kind of like loud music, things that overstimulate the brain, flying in an airplane where it could increase the pressure as well. And so those kind of things, we want to be avoiding those. Any kind of physical or mental stressful activities. So you want to talk to be working with your healthcare provider when it comes to this and getting their opinion as far as when you can actually return to actually doing those activities again. That's going to be really important, because you don't want to, like I said, you don't want to get into those too early, because that can really delay your recovery, or it can maybe even put you at risk if it's playing sports, of having another concussion before your brain is fully healed. But one of the things that we see that really can help support your brain as far as the healing process goes is eating lots of good, healthy fats. So your brain is actually the fattiest organ in your body. Many of you out there probably didn't know that, but it's the fattiest organ in your body. So about 70% of it's made up of cholesterol and fats. And so basically consuming lots of good, healthy fats through your diet is going to help give your brain and your body those building blocks that it needs to, number 1, reduce that inflammation, but number 2, help to repair those damaged cells that resulted from the trauma. So some examples of good healthy fats are things like coconut oil, things like bone broth, avocados, raw nuts and seeds, full fat, coconut milk. Canned coconut milk is great source of healthy fats. Grass-fed organic meats, wild caught salmon, things like that. Those are all excellent fats to be increasing in your diet, as well as you can take some fish oil or omega supplements as well. You just want to make sure it's a good quality one, because a lot of times they don't have the best oils in there. They may even be gone rancid. So oils like a canola oil, vegetable oil, safflower oil, some of those other oils, margarine, those are really bad fats, bad oils. You want to be avoiding those, because those are actually just going to increase the inflammation in your body, which is going to slow the healing process down and cause a lot more issues for you. So the 6th thing here is what we call Beemer vascular therapy. So this is something that we have our patients doing in our office. So basically, Beemer, it's a type of PEMF, so pulsed electromagnetic frequency. And what it does is it pulses a magnetic frequency, and you can adjust the intensity and the time that it does that. And it pulses that frequency, and it helps to basically open up your body's tiny little capillaries, which basically makes up about 76% of your blood vessels, are these tiny capillaries that get to all the little nooks and crannies and tiny spaces in your body, to provide those cells with oxygen and the nutrients that it needs to heal and to stay healthy. And so when you're doing the Beemer therapy, that helps to get that oxygen and get those nutrients to where they need to go, and that's going to help your body, your brain, everything recover that much faster. In fact, a lot of Olympic teams are actually using it right now with their athletes. If they've worked out really hard, you build up that lactic acid, and or if you have like an injury as well, especially like to the ligaments or discs or tendons, they don't have very good blood supplies. So by doing the Beemer therapy, it helps to get as much circulation as it can to those areas, and that helps the body heal and recover much faster from those injuries. So that's basically why we use it with our patients in our office, because that helps support what we're doing with the adjustments, and the corrective chiropractor helps get more oxygen out to the body and speeds along that healing process. So then the last thing here is you want to make sure that if you've suffered a concussion, been in some kind of trauma, you definitely want to make sure that you have your spine properly evaluated. So, like I said, if you had enough trauma to your head to cause a concussion, chances are it probably affected your spine as well. And so the reality is that many of the symptoms that are associated with concussions can also overlap and can be also associated with subluxations, or when the spine and the bones of the spine are actually out of that proper alignment. So what we do in our office to find out if that is indeed the case is we do a full history, we do an exam, we do a spinal evaluation where we can actually look at the spine and nerve system to find out if there's, thermography scan to find out if there's any inflammation along there. And then we also do digital x-rays as well. And then that way we can see if there is damage there, how long it's been there, how things are out of alignment, what we need to do to come up with a specific plan to be able to help you actually get that corrected as soon as possible. And that's going to help your brain heal faster. It's going to help with a lot of those associated symptoms and pain and problems as well. And so that's what we do. So normally if you come into our office and have all that testing done, it's over $200 to be able to do that. But we've opened up 3 spots here for the first 3 callers today on the show to call in and take advantage of all that testing just for $50. Okay, so the number to call to do that and get that set up is 509-241-3088. Again, 509-241-3088. That's the number to pick up and call to set up that time to come in and have your spine and nerve system evaluated. So we have a patient here that came in. She's been coming in for probably good 6-7 months now. But when she first started, she was having tremendous headaches, which can be associated with concussions. But the reason kind of what we were able to find out was that a lot of these issues that she was dealing with actually stem from a car accident that she was in years ago. And like I said earlier, a lot of times people are in these accidents and they have some sort of trauma, and they go in and maybe they get some treatment for a little while or get checked out, and they're told that there's no broken bones or fractures and that they're fine. So they might get a neck brace or something like that, but nothing really happens. And a lot of times the symptoms don't really show up right away. So she was in a really bad car wreck, and shortly after she was in that car accident, she started to have all of these pains and problems showing up. So headaches, she was getting tingling in her hands, back pain, hip pain. She's also actually gaining weight and really having a hard time, getting it off. And so she hadn't been to a chiropractor before. So we did did the nerve system assessment with her, found out that her neck was actually going the wrong direction from what it should be. She had some scoliosis in her spine. And so we started to put together a specific plan for her. She was coming in for adjustments. Plus we had her doing, some extra things at home as well, which is kind of the key thing that's different about our office than, the average, chiropractors. We do corrective care. So we're not just focused on where your pain or aches are. We're actually focused on correcting your posture, correcting your spine, and we're able to see your progress over time because we also will re-x-ray you. And that way we're not just guessing that you're getting better because you're feeling better at that point, but we can see that your posture's improving. You're starting to get the curve back in your neck that you've probably lost if you've been in some kind of car accident or had a whiplash. And so that's what we were working with this patient here on. And it's just been amazing to see her progress. Like, she's doing so much better. Really, it's why I love what I do. And so right now, she's rare to have any kind of headaches. Her back pain, her neck pain is doing much, 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 much better. And she started to, through doing the adjustments, typically what happens is that once people start to make one positive, healthy habit, it starts to, kind of cascade into other positive, healthy habits as well. So we're coaching her a little bit on her nutrition, giving her some pointers, telling her what supplements that she needed to take. And literally it's been, like I said, about 6 months, 7 months. And she's lost 60 pounds and she just feels so much better. Her blood tests are coming back. Her cholesterol's down, her blood pressure's down. And the cool thing is that one of the things that she's really passionate about and loves to do is biking. And because she was in so much pain before, and whenever she'd bike, her hands would go numb because her neck was in such bad shape. So since she's been coming in and getting her spine worked on, now she's able to bike 20, 30, 40 plus miles. and feel fine, not have any aches or soreness after. And it's been really cool to see that. So again, right now, if you're out there right now suffering, you know that you're not where you really want to be with your health, and we've opened up a few spots for you guys to come in and have your spine and nerve system assessment done. So many of you out there have never had it done, or maybe it's been quite a while, and you don't really know where your spine's at right now at the moment. Maybe you've recently suffered from a car accident or a fall, a work injury. So if you've had any kind of injury like that, where potentially you had a concussion, then you definitely need to have your spine checked, because that can also really affect your spine. And all it takes is about 72 hours of the spine actually being out of alignment that you'll start to have scar tissue set in. And once the scar tissue starts to set in, it makes it a lot more difficult to see changes with your spine. And then things will start to degenerate, and that leads to arthritis. And we definitely don't want people to go down that path. So the sooner the better that you can start to at least get it checked out, find out if there is problems there. If not, great. But again, we've opened up those 3 spots. If you're out there right now and you want to have your spine and nerve system checked, to come in, we'll do a history, then exam, nerve scan, digital x-rays, and normally that's over $200 to do that. But if you're one of the top 3 callers today on the show, we're going to have a chance to do that just for $50. So what you're going to want to do is pick up the phone and just give us a call at 509-241-3088. Again, 509-241-3088 is the number to call. And again, make sure that you leave us a message. A lot of times we have multiple people calling in all at the same time. We're not always able to take everybody's call right away. But if you leave us a message, you're one of the top 3 callers, we'll definitely get back in touch with you to help you get that appointment scheduled up, where you can come in, meet with me, and we can help see if there's any potential problems with your spine, and come up with a plan on what we can do to help you out. So that's all the time that we have today, guys. Thanks so much for joining us. This is the True Health Talk radio show with Dr. Brian, and we'll talk to you guys next week.
You have been listening to the True Health Talk program with Dr. Brian Wickstrom, heard every Monday and Thursday at 12:30 and Saturday at 10 on KTW 630 AM and KTW 96.5 FM. For more information on how to improve your health or to request a consultation with Dr. Brian Wickstrom, you may visit www.rccspokanevalley.com.